Okay, so all right, my name's Rahman Faraz. I'm the host of the Ross University Surgery Interest Group podcast. I have here with me Dr. Alyson Morgan, a fourth-year resident and a former Rossi. I'll let you do the rest of the introduction.
Yeah, I mean, that's pretty much the big gist of it is I'm Allie. I graduated from Ross in 2021. I was a part of the floating university and all of the fun times that came surrounding that, and then ended up matching into general surgery in Warren, Ohio, and I've been here for the last 4 years.
Okay, and where did you grow up? Where are you from? If you're from the States or internationally?
Yeah, so I grew up in Washington State, went to college there. After college, was trying to figure out what to do with the next step and whether I truly wanted to do medicine or if I wanted to kind of go into more of the psychology route. And so I kind of was just killing some time and working in California, which is where I moved to. That's where my family also was. My parents are divorced, so I grew up kind of between Washington State and California. So moved to California after I graduated from college, and was working in a clinical laboratory before I applied to Ross. And I actually went to the MERT program. So I did more or less a semester before starting on the island. At that point, it was Dominica, not Barbados, but participated in the MERT program, passed, went on as a first semester student, and obviously was derailed at some point in that when we had the Hurricane Maria. And so let's see, when was that? It was 2008, 17. So I was my third semester. I think it was right at the beginning of third semester for me, and ended up getting evacuated and then was on a cruise ship, for lack of better words, but a glorious name for it, for 3 months, and then went on to Knoxville for one semester before I started my clinicals. And I actually did my clinicals. I was a core student at California Hospital Medical Center in Los Angeles, and then COVID hit. So that was my first semester, or first rotation as a fourth year clinical student. So that derailed a lot of those plans as well, and had to do a lot of improvising in terms of rotations and trying to keep on track for graduation. And at the time, both during the hurricane and during that period, I was president of our clinical SGA and then SGA on the island. So lots of fun, exciting challenges and stresses and all of the above types of situations.
Yeah, it's already a challenge for a lot of students just going to an island, but you had to deal with the hurricane situation and COVID. So
yeah, very unique set of students for us. Our classes in that time period, we had a lot of different, like I said, improvisations that had to be kind of, we had to make some calls on the fly and whatnot, but made it through, perseverance.
And you're in general surgery residency, so you're as tough as they come.
Well, it was nice. It gave something very easy to talk about during interviews, that's for sure.
Yeah, I'm sure. So, what got you started into medicine? Did you have a passion from before, or it was kind of like I reached a point in my life, hey, this seems like a career I might enjoy?
So for me, I got excited about medicine when I was growing up in church, and I would see some of the medical missionaries come through, and they would talk about their time and their ability to give back to people of less fortunate countries and whatnot. And that was just something that fascinated me absolutely. And still a huge passion of mine is global health and trying to, bring someone who's the same age as me growing up, but in a different country, who doesn't have the same opportunities as I do in terms of vaccinations, healthcare, all of that. I wanted to kind of bridge that gap and that disparity. And that was a really big driving force for me. And once I got into college, I kind of thought, maybe psychiatry, psychology was kind of more my calling. And I actually thought maybe I wanted to go into drug counseling and detox and things, before I realized, this is just what I like about it is the decompensated patient who comes in and needs help and needs to kind of be stabilized. And that ended up kind of morphing into, oh, it's actually medicine probably more that I'm interested in, and that clinical disease process and whatnot. And so I went into medicine and going through rotations as a student and thinking, oh, I still like psychiatry and I still like the decompensated patient who needs to be helped, with an acute issue. And then did my surgery rotation as a core student. And I was like, oh, this is like all the time, decompensated people and people that need help right away. And you can wheel them out after taking out their appendix and they can already be starting to, improve clinically. And so that ended up being kind of a big eye opener for me, because I actually thought, before I ended up applying to surgery, I thought I wanted to do med psych. And I think that was really just me trying to delay making a decision and feeling like I was really sure of myself. And that was it didn't take very long, because then I got into my surgery core rotation and I was just like, no, I really enjoy this. I like working with my hands. I like the patients who are sick and need to be helped right away. I have a big draw towards trauma and critical care, which is what I'm applying to for fellowship. So it really kind of just morphed, and it's hard. I know there's some people who have like that really hard and fast, that was the aha moment. It was an aha period, like a couple of weeks, but that's really what I would pin it down to.
So was there ever a single case during your core rotation, or was it just overall your core rotation, all the experiences bundled up? This is what I want to do.
It was all of it bundled up, but there is always one case that really sticks out for me. And it was the way that they do core rotations, or at least they did at the time at California Hospital, was you ended up having occasionally some overnight type trauma call shifts, essentially. And so a lot of times it's just you and the attending. And we had a gunshot victim come in, and he was 19 years old. And he was in extremis, and he was, pretty much dying in front of us, had an abdomen gunshot wound, and had to rush him to the OR. And it was really just the attending and me. And thinking back on it now, I really wonder, and I'm intrigued to find out what it's like eventually when I am an attending, but thinking of what it is to be an attending on and not know what you're completely going into in the OR, but what kind of help you're going to have going into it as well, especially with students and, mid-level providers that are available from time to time. And we had an APP on at the time, or mid-level provider, and they were like, oh, cool, you're here, you're going to scrub in. Sounds good. I'll be out here. And it was just kind of like one of those, oh, wow. Okay. So it's me and the doctor. And we went in and we ended up X-lapping and cutting him open, stern to stem, and finding a lot of bleeding, and he ended up coding, and we had to do, intraoperative thoracotomy, like all types of resuscitative efforts. And it was just, it was one of those things where I didn't feel like I was really skipping a beat, like I was able to follow what he was doing. I understood. He was a really good teacher, for one, but just one of those situations that you're not going to forget easily, and a good adrenaline rush, obviously. But that was probably one of the biggest moments that I look back on and talk about, because it's just so impactful. And being able to talk to the family afterwards, the patient himself, but his mother who's sitting there crying, thanking you for saving her son's life. And I know through that rotation, even when he would come for follow-up, I would see him in the clinic. They would text me and they'd be like, hey, I'm here in clinic. And I would come down and I would say hi, just because it was such an impactful patient and provider relationship. So it was a really good peek at what can happen. Obviously, trauma and critical care, it can end up going the other way as well. And that's completely understood. But for the wins that you do have, it can be a really big win, which is really, really nice.
And the reason I asked that question was because a lot of times students want to go into surgery, but after their core rotation, they're still unsure sometimes. So was that an experience where you're like, I'm almost certain? There's always a little bit of doubt, whether I will match, whether I even want to do this. I want to go into a very difficult residency. Was this like a great motivator for you? Hey, everything med psych, psychiatry, all of that stuff is kind of like not really my priority anymore. I want to do surgery.
Yeah, I would say it was definitely a big motivator for me, as well as being able to kind of talk about and realize, I really understood what was going on. I was able to follow along with what was happening, and I was able to kind of keep pace, more or less. I mean, you understand when you're a student, you almost can only understand so far as to what you're doing because
Right.
everything is
Yep.
so new and everything is so big. But looking back on it, it just felt like one of those eye-opening moments. And that's not to say that I didn't have doubts still, because I went into that rotation recognizing that, I had an interest in surgery, but I didn't think that that was going to be it because women aren't surgeons. I don't see any women surgeons, walking around the hospital, or at least very few. And I didn't have a whole lot of exposure to women surgeons. And so that was a
Right.
really big concern. And that was a really big hurdle for me to kind of get over and to realize that no, that's not the norm these days. It's transitioning, and it's in a nice season of change where it can you can see a lot of really strong females in surgery.
Right.
I think
Right.
that was probably a really big situation for me. That was one of the biggest hurdles that I had to overcome in terms of saying, okay, yes, I'm gonna apply to surgery, because I was worried of being, a fertile female, eventually
Right.
wanting to have a family. That is not always the lifestyle that's conducive, because you have to really marry your job a lot of the time. And that's something that I have realized even moving forward. And my other half is also a surgeon, so it's going to be an interesting. I don't even know, figure out how to have a two surgeon household. But
Yeah.
that's
Everything
part of
has to
what I
be
like.
planned.
Yeah, exactly. That's part of what I like about trauma and critical care, is that I'm going to have a little bit more of a predictability to my schedule, because
Okay.
I'm on call or I'm not.
Okay.
It's not
Okay.
it's not like I have my elective practice and I'm maybe on call these days, and then we have to pepper in his on call schedule. He will have an on call schedule, but I will be scheduled or I'm not. So that will be helpful to have that predictability.
Right. So it seems like you have worked out a system with your partner at both as surgeons. So hopefully this is an inspiring story to our audience about especially females that want to go into surgery.
Yeah.
Um, so how was your transition from a medical student where you're limited with all you're going into surgery, you've applied, and now you're transitioning to get matched into surgery, and now you have all this information being thrown at you. And in my experience, I'm not a resident yet, but it seems like there's a lot of stuff that's just not taught in medical school because it's more hands-on techniques and
Yeah.
whatnot. So tell us about that, how you transitioned into residency, how that came about to where you are now.
Yeah, I mean, you hear about people who talk about residency, especially intern year, as, drinking from a fire hose. Even just medical school is like drinking from a fire hose. This is a new fire hose that you've come to. So it's information overload, and it's really just about figuring out how to balance the incoming information and what you're giving back and putting out, um, more so than it's a different beast. Like, it's really hard to put into a systematic, algorithm for everyone, because it's really just figuring out how to get your sea legs, sure, but then kind of going from the walk to the run. I think the transition from me, a lot of it was leaning on my co-interns. I think that that's something that's really important. So trying to build a relationship with the other residents that you're with, but especially your other interns. You might not always see each other, which is what's kind of an odd thing, because you think, oh yeah, this is my class and it's going to be great, but then you end up going on different rotations and different blocks and all this stuff. So you end up almost alienating from yourselves. So it's important to build those relationships when you can, and that's going to be your support system. Obviously, having support at home is very helpful. It's
Right.
not something that everybody goes into residency having. So I think that that's a big factor, is trying to figure out how to foster an environment that's supportive for you, because this is going to be intern year it's such a different scenario than you're used to. that's kind of how it's a season of change throughout all of med school, and you get to the next step and you're like, oh, okay. And then you feel like you get into a good rhythm and you're like, cool, next time for another change. It's the exact same thing with internship, and going into that year. And it can look different for everyone because it depends on what your situation is. I was very fortunate to be a categorical, especially in surgery. And I couldn't tell you what it is that got me there. It is absolutely, beyond me. But I think it's important to find that that support system within your peers, because they're the ones who understand it the most. They're going through it at the same time as you, and you're able to work with each other. You are only going to be as strong as your weakest link, and if you make your weakest link as strong as the rest, then you're not going to falter, and that's what's really, really helpful in this environment, because it's sink or swim, and there's some people who are out there only for themselves, and I applaud them. I think that that's really, it's important. You have to look at your own success. You have to be, you are the maker of your own success.
Right.
But being able to have that successful trajectory without it being at the expense of others is absolutely invaluable. And that's something that I will forever and a day harp on, because I think that is so, so important. And that comes from being supportive for one another.
Right. And so going from intern year, where it's like so much information, you're building your team, you're building connections, hopefully positive, like you mentioned.
Mm-hmm.
But how does that transform into and translate into how you work in second year of residency as a surgeon? Is it like a stepwise decline, or is it you just get better? How does that work?
Everybody always says, oh, second year is so much better. Second year is so much better. It is like, it really, there's no trickery there. It just is better. And a lot of that is because you've tackled some of that new stuff coming at you through that fire hose, right? You understand how to maybe manage your time. You understand how to manage and juggle a bunch of patients. You understand where it is that you need to work on a little bit more within the OR, within your medical knowledge, that kind of stuff. So I really think it's about just being able to juggle all of the balls that are in the air. I think, what was I going to say? I think second year is probably a nice little sweet spot, because you're not an intern anymore. So you're not low man on the totem pole. And that is going to look different at different programs for sure. That's something that can't be universalized, but you're still, and this is going to sound silly, but you're still kind of the intern of the mid-levels, if that makes sense. So you're going to get to a point and you're going to be like, oh yes, like, I'm not carrying the pager, or I'm not the one having to answer the silly, calls in the middle of the night on night float, or whatever it is. But now you have to recognize your responsibility has shifted a little bit. So at my program, as a second year, you're now one of the most senior in the hospital at night. That's a lot. It's a lot. You still have a chief, there's still a hierarchy. That's not to say that you are absolutely on your own. However, it's a growth pain that you kind of like what you're talking about, of trying to figure out, okay, now I'm supposed to be the one in charge. I'm supposed to be the one showing someone else the ropes and how to figure out how to manage the patients and how to answer all the pages and how to do all these things. So it's not to say that it's not tough, because it definitely is. Each year something gets added. So you're doing all the things that you were doing the year before, but now it shifts a little bit and it becomes a little bit maybe hotter under your, under the pot, trying to crank up what your responsibility is and how you're functioning as eventually, a standalone surgeon. It's important. Yeah. Like, what we're doing is very important. People's lives are in our hands. That cannot be stated enough.
And it seems like the system's just trying to make you better, but slowly, but eventually you're going to reach that position where you can just be an attending. And it, to me, on the outside looking in, it looks like it's a stepwise increase in knowledge, while kind of decreasing the workload maybe, but increasing the responsibility. And
it's a change in the workload, because it's not necessarily, again, that's going to be site specific and program specific, but I do think because you may not have as much of, maybe you're not writing as many notes, but now you're maybe writing a lot more of the operative notes, or you're making a little bit more of the decisions with the patients, or in the operating room, you're showing a little bit more of your skill. You're given a little bit more time to kind of sink or swim. So it's always a transition. Everything is always, it's never in my opinion, it doesn't ever seem like it's a real cut and dry. It's always just a shift slowly. And that's important. You brought up something, what did you say earlier? You were talking about how the second year can change and you have more responsibility and things like that. And I think it's really important to highlight that how your program, there's going to be situations where you're going to have attendings who are rough. They might have personal vendettas. There's a lot of different personalities in medicine in general. Yes. And I think it's important to recognize that sometimes those are not reflections of yourself, but of other people. So it's important to always be responsible for your own, what you're putting into that equation, right? So trying to keep a positive attitude is absolutely a great thing. Trying to support other people is a great thing. Always trying to give back to the person, farther down the ladder as you're continuing to climb, I think is really important.
Okay. That was really good. That might need to be a quote. It's not a reflection of you, but other people's personalities. So hopefully the audience takes away from that.
It's important to remember there's going to be days when it's hard, you get yelled at or something. And I have to say, I think that medicine doesn't need to be that way. I think that it's a shift in culture, but it still exists. And I think there are a lot of individuals who are trying to overcome some of that old school mindset and, some of the stigmas that are still around. But it's really important to recognize your own worth, recognize how important you are. And if this is not conducive to your mental health, like, it's okay to step back and say, you know what, I can't do this. That's what's most important, is being safe, because not only do you need to be safe for your patients, you need to be safe for yourself.
Yes.
It's important.
Yes. And maybe also understanding your own self-worth, that can also help you once you're a resident, once some of the medical students become residents, they start to realize that they can also understand other people. Hey, they might be in this position and we would be the change in the future.
Yeah, exactly. And that is something that I'm pretty passionate about in terms of, improving wellness and those types of aspects of resident training and whatnot.
Right. Because surgeries, anytime I mention to my friends, hey, I'm applying to surgery, it's like, oh my gosh, why are you doing that? Why are you doing that to yourself?
And I said it at the beginning. I said, I know when we had talked earlier, I said, congratulations, but also I'm sorry.
Yeah. So I have friends. Why do you want to do that to yourself? Well, you're going to be miserable, this and that. And so sometimes it's also like, I also question myself. Am I going to be happy? Is this something I want to do?
Right.
But so I want to ask you, what are some challenges you're facing currently in your fourth year? I know you just took the big exam. So tell us about challenges as a fourth year and you going on to your fifth year, and potentially, I believe you said you were applying for fellowship.
Yes. It starts, next month. The applications will open. So I'll be applying to trauma and critical care and acute care surgery.
Okay.
But current struggles as a fourth year, I think, well, for one, trauma and acute care is a little bit of a later, like my co-resident, he applied before the end of the year. So at the very beginning of the year as a fourth year. And so we end up having a pretty much a later match period and whatnot. And that's just the luck of what the specialty has chosen. But I think as a fourth year, one of the real struggles that you have to kind of start going into is I'm starting to become a chief. I'm starting to make the chief level decisions. I'm running a service. And that really is, again, it's another shift in that, control that you have over the reins and trying to figure out how to manage yet another ball in the air. You've sort of gotten a lot of the other stuff out of the way. A lot of it you understand how to manage, but starting to be the real big man on campus, that carries with it a whole nother bag of worms. I'd say that's probably the biggest struggle, in my opinion, is trying to figure out how to lead a team, how to foster that positive attitude that I was talking about, and that camaraderie that you can't just make up in a day. I think for me, one of the things that I'm trying to do is, what month is this? This is almost February. So in just a few months, I'm 2/3 almost of the way through the year, so
Right.
Pretty soon I'm going to be looking at actually being, 5th year chief. And with that, I think setting a tone of acceptance and that I understand that we're all coming in here. You're going to make mistakes. If you recognize it, the sooner you recognize it, the better, because then that kind of takes a little bit of the pressure off of your shoulders. You understand, you recognize, but then not forgetting. And maybe one of the things that I want to bring to it is being able to be a reminder that you do have worth, because sometimes it's hard to foster that self-worth that we were talking about earlier. Right. So trying to instill that and inspire that in others, I think is a really important aspect of leadership. And I that's what I'd like to bring as I transition towards being a 5th year.
Okay, that was really great. I didn't anticipate that would be a challenge. I thought maybe like application or the exam was brutal.
I mean, yeah, the exam, it's a necessary evil, Right. Probably 1st or 2nd year, I would have said that a little bit more, only because it's still a bit fresh.
Yeah.
And you're never going to understand. AppSite is so difficult the first year, in my opinion, because you just don't know what you're up against until you've done it.
Okay.
And so, and that's probably true. I've never taken any of the other in trainings, but I would imagine that's pretty universally recognized. It's like STEP, the first time that you took STEP, you didn't know what you're walking into until you walk into it and you take it. And then you're like, oh, crap.
Yeah.
That was tough.
Okay. All right. So now you're applying, or you're soon going to be applying to trauma. What led you to trauma specifically compared to when you got into general surgery and you have everything else as a subspecialty, or possibly just saying, hey, I just want to do 4 years. I don't want to do this anymore. Well, what's your motivator and what specifically do you like about trauma? I know you mentioned the case in medical school that you saw. Was there anything else?
Yeah, I think that was a really big part of it. It's the idea of a patient coming to you with a clear-cut issue and you're able to fix it and they're able to be wheeled out of the operating room in a better state. Sometimes not, but that's a lot of what the goal is, right? So I think that that's a really big motivator for me. I would also like to think that I feel like it takes, traumas, the patients, their families, you're often meeting them on one of their worst days. Mm-hmm. And I think it can be very taxing for them. So trying to be in a situation where I'm able to perhaps give that support, it's something that you don't always see throughout all of medicine, and being able to be present for a patient and their family in that way. I think it's a real honor, and it's something that I take very seriously. And it's something that I'm really, I think that's one of the draws, which is kind of an odd outlook to have, but I think that it's a very lucky position to find myself, and I don't take it lightly, like I said, and I'm very honored for the opportunity. Yeah. If I get it, obviously. Yes. But that was kind of the main thing. I also I like the critical care medicine, especially as a female, being able to have somewhat of a, I don't want to say a backup, but it is another avenue that I can explore in terms of becoming non-surgical someday with kids or whatever. It does give you a lot more in your repertoire in terms of what careers you have ahead of you and available to you.
Okay. Yeah. I didn't know that was possible. So you would go from like a surgical standpoint to non-surgical in critical care?
You can, yeah. Possibly, you could be an intensivist essentially. Yeah. So, that can be a really big draw, especially for females. And a lot of times, you hear stories of surgeons who succumb to some form of illness where they can't operate anymore, but they're able to continue to offer medicine and take patients and whatnot as an intensivist. So it's definitely a plus in that regard. It's not like one of my main things that I'm looking at. However, it is definitely something that was a pro, if that makes sense.
Right. If the scenario were ever to arise, I would have, some tools that I
Yeah.
can still use. Okay.
Yeah.
That's great. Yeah, that's one of my nightmares. In the back of my mind, it's like, okay, what if something happens, I get a tremor in my hands, I can't do surgery
Right.
anymore? Well, what would happen? So I'm very glad to hear that, and I'm sure so is the audience. Especially the females, like you said, from that standpoint, if you ever, go into that subspecialty, you have that as an option. And I think that might take off a lot of pressure for some people.
Yeah, there's my program director has told a story of a former resident who, I don't remember what year of training he was in, but at some point, maybe his third year or so, he was diagnosed with MS. And that was a really, obviously a heavy blow, especially there's a lot of pride that comes in becoming a surgeon and whatnot.
Right.
And a lot of that is, and I'll say ego, but I don't mean it in the negative sense of the word.
Right.
But I'm sure that would have been a really leveling realization and diagnosis to be given.
Yeah.
And he went into critical care because he was already past halfway. You want to continue through and finish out your training. But so it's important to know that that's something, like, it's not, you're not wasting what training he's gone through and whatnot. So it's just, that's always a nice anecdote to hear about when it comes to thinking about career trajectory and whatnot.
Yeah. So I'm going to kind of move away from academia a little bit because we want to know about your personal life, especially being a female in medicine as a surgeon. What were your initial feelings when you became a surgeon or a surgery resident, you matched and you're like, okay, am I going to be able to work this out? Were you scared or were you hopeful it's going to turn out okay?
I think all of the above. I mean, if not, I don't think we'd be here talking. One of the biggest things, I still have the days where I'm like, gosh, did I do the right thing? Did I make the right decision? And I think that just shows, the gravity of the decisions that we're making as medical students. And then again, as residents. But I think ultimately what's important is I have had nothing but a positive outlook on what I have gone through, the trials, the tribulations. Obviously, there's a lot going through as a medical student and then going into residency. And I ultimately think that it was just a positive relationship. And I'm looking forward to finding some work balance at some point, I'm sure. They always say that there's light at the end of the tunnel.
How do you do work-life balance
it's hard
up till your fourth year?
It's definitely hard. That's one of the things that I think people have to recognize is that you're going to have to put some time in and there's going to be sacrifices, and it's really unfortunate. And it's something that we all have to go through. And that's why I harp so much on finding a support system, because that's very, very important to keep you sane. But that being said, there is there's some light at the end of the tunnel. You're able to, I'm sure I can see one of my cats in the corner of my eye is already trying to sneak onto the screen. Oh, she sat down. Good. She might be at bay for now. But having something to look forward to outside of the hospital is really important. So like for me, I bought a house when I moved here, and I made sure that I was surrounding myself in a situation and in a home that I felt I wanted to go home to. I was excited to get home to. And that involves my cats. I ended up rescuing one of them when I was a student in Los Angeles at my course. So she came with me to Ohio, and then I had the understanding that she needed something to hang out with during the day because it wouldn't be me. So I ended up rescuing another cat when I moved here. And so they're growing up together. I think that's been a really big joy for me, is having my animals. I wish I could have a dog. I don't have a dog someday, but right now I don't feel like time is my own enough to take care of a dog. But there are people who do it. I have co-residents who have dogs and they're able to make it work, and that's fantastic. And I'm very, very happy for them. So, pets, I think pets are a very big, important thing to have of work-life balance. I'm very fortunate in that like you said, that my partner, he was a couple of years ahead of me in residency. And so for him, to really understand what I'm going through at work and already have kind of that taken care of in terms of understanding how our dynamic will work as residents and whatnot, was very helpful.
Right. Okay.
I'm trying to think what else.
Do you have any hobbies that you get to enjoy?
Yes. I actually, my big thing right now, I'm on a kick for crocheting. I know that that's kind of an old woman hobby, which is fine. But I actually started it before residency, to try and pick up some more dexterity, and kind of work on my hand strength. And I've just continued to carry through with it. I didn't really have the intention of showing, but I finished this little dumpster fire that I made yesterday. It's for my program coordinator. So I've just been able to kind of translate that into joy. Yes. Something to do, something to have that's outside of work, that's a little bit, not really mindless, but it's a little bit less intense.
But also functional, because you, like you said, you're working on your dexterity. So that's great. I think that's a perfect hobby for a surgeon.
And it's applicable. It's a dumpster fire.
Yeah.
That's what residency can be sometimes.
So outside of that, like, if somebody is like into sports, or they love traveling, what advice may you have for them, if any?
Well, it's still possible, I can tell you that much. Last year, my fiance and I, we went on a big group trip to Greece. I had never been to Greece before, so I got to go there. That was really, really nice. I think it's just a matter of what you can plan for. And I think that a lot of times what we end up doing, and we've kind of discussed this as residents, when you have a break, sometimes all you want to do is relax, and that's okay. That's completely fine. That's one of the things that I had to kind of come to terms with, and realize that vacations sometimes need to be vacations, especially when you're moving to a place that you don't have family, you don't have friends, whatever. It can be a little bit difficult because your vacations become go and visit family, go and try and not miss out on the stuff you're missing out on the rest of the year. So I think trying to find a balance between those in terms of doing those types of things and making sure that you're seeing family and kind of filling your tank in that regard, but also taking some time for yourself to go and do some traveling. I think it's very possible. I would definitely, if that's important to you, then you have to make it happen. And that's kind of the biggest thing, is you got to figure out what fills your tank and what's important to you, and how to continue to utilize that time in a way that's positive and it's going to help you be stronger when you come back.
Great. Yeah, I think planning is a big one. And sometimes just, I'm not a resident yet, but even after my sub-Is, I'm just like tired. I don't want to go anywhere. And, I tell my family, I tell my family, I just want to sit at home. I just want to sit at home and maybe sleep, watch TV, be a little lazy. I think I've earned it. So it's that I feel guilty for it, but I'm glad to hear that it's okay.
To be fair, you're going to feel guilty about something, right? So there's times when you're going to want to be at home feeling lazy and do nothing, and then you'll feel guilty afterwards because you didn't do anything. And then there's going to be times that you go, and you're doing all the things and you're seeing all the people. And then afterwards, you're going to feel maybe not guilty, but a little bit of, like, man, why didn't I, prioritize getting some more rest or whatnot? So it's really about just trying to listen to your body and your mind and figure out how to continue to nurture yourself. Because if you're not taking care of yourself, there's no way we should be expecting you to take care of others.
Right. Okay. I think that was all great advice. I think that was really good insight. The main thing I believe you're our first resident we've had on the podcast. So we really wanted to see what residency was like from somebody that's currently undergoing it or is very familiar with it in today's day. We've had some surgeons, but they did residency, many, many years ago. So,
5 or more, yeah.
yeah, and most of the interest group students, they're applying to surgery within a year or two. So this is all, current information. If you have any advice to students applying to surgery, what would that one piece of advice, what would that be?
Oh, one piece. I think
I
it's a little bit
know.
multifactorial. I think take everything that you hear with a grain of salt, because my experience is my experience. That doesn't mean it's the same for even 2-3 other residents at my same program. I think recognizing that every program for every person is going to be different, because what might be an absolute fit for me as a program isn't for, my partner. And so I think that the most important thing that I could tell every resident is to stay true to yourself. Find the program where it's going to help nourish you into a better person, a better doctor, a better team member, and a better, friend. Just the important thing is that you're not just fostering yourself as a future, worker of America. You're fostering yourself as a future citizen and whatnot of America. So it's really about being well-rounded, staying true to yourself, finding that support, and making sure that you're not settling on some of those things that are really, really important, like your self-worth, your
of course, yeah,
wellness, all of that. That's really, really the biggest thing that I would say, because if you're not in an environment where you feel safe mentally, physically, whatever, you're not going to flourish. And it's really now is about flourishing for yourself and for your patients.
Right. I agree. And it kind of reminds me of when I get on a plane and they're like, put your mask on before you help somebody else. So make sure our mental health is in check.
Right.
I have one question for you. If you weren't a surgeon, what would you be doing?
Well, I'd probably be a grandma, crocheting all of these different things. I think if I wasn't a surgeon, I would probably be doing something. I'd probably be rescuing a lot of animals. I would probably be dedicating my time to trying to foster animals and whatnot, because I really think community service in some fashion is really a big, huge passion of mine. And it's hard as a resident because you don't have a lot of time that's your own. So it's hard to have maybe some of those, like I said, the things that fill your tank. That's one of the things that fills my tank. And so I'd probably be rescuing about 1,000 cats somewhere,
A
and
rescue
dogs
shelter, yeah.
and whatnot. Yeah, just trying to help take some of those things off the street and give them a loving home.
Okay, that's amazing. That's something my mom always wants to do. So hopefully I can make her dream come true.
Perfect.
So I have one quote of yours I was looking at, and I just want to share it with the audience. If you could just give me 1 second. Um, so you wrote, and I'm not sure if you still remember this, but you wrote, when we are residents ourselves, please use whatever influence you may have to help our Rossies get their foot in whatever doors possible, because we know how hard and stressful it can be. And I loved that because becoming a doctor from the Caribbean, becoming a surgeon from the Caribbean, it's a journey that not many people have, very difficult to achieve, and it just resonates with the Ross students. And for somebody to get their foot get out of the Caribbean, match into a competitive specialty, and still be able to look back, I want to help for you to come on this podcast and still help remembering where you came from. I thank you so much. I cannot thank you enough. And that was beautiful because it sounded like you kind of wrote that in medical school, but you stayed true to it. So
Yeah,
thank you so
I'm
much.
trying to think of when I even. Do you know what that's from?
Yes, it's from the alumni panel, or sorry, the match panel for your year.
Yeah, was it in the like I'm trying to think of what is like a newsletter type thing, right?
Yeah, Match
Yeah, okay.
2021
I
newsletter.
remember that.
Yeah, so I saw it and I was like, wow, I send out many, many emails for, to be a guest on the podcast. And of course, like the field, you're going to get a lot of rejections. And you still, you pulled through for the other Ross students, especially the ones that want to go to surgery. And you had said it and you did it. So thank you.
Yeah, no problem. I really do feel strongly about, you know, it's I think I heard it first in the Tim McGraw song many years ago, but um when you get where you're going, make sure that you turn around and help the others in line, because that's what's important to me. That's where I think that's the only way that we can help give back. That's a legacy that you can't undo
Right. So
in a good way.
seeing you do that, I vow, I promise on record that I will also return the favor to the classes to come after me.
Yay, I
Um,
love it.
just to wrap up, is there anything you would like to share?
Um, I don't think so. I think I'm excited for the raw students who are interested and are planning to or have already applied to surgery. And if they have any questions, feel free to reach out to me. Email, whatever, is not a problem. I'm more than happy to answer questions, to give back however I can.
Okay. We
But it's
promise
an
not to
exciting
bother you a
journey.
lot.
It's fine. It's fine. It's an exciting journey, and it's important to look around and enjoy the view of what you're doing, because it's very important. But um, but absolutely, I commend everyone, and I'm excited for everyone who's going on that journey.
Thank you so much, Dr. Morgan. We thank you for your time. We thank you for your words of wisdom, sharing your journey and your personal life. We hope to hear from you sometime in the near future whenever you do have the time and you can give us updates on your journey.
Yes.
So once again, thank you. And
Thank you
that
for
would
having
be
me.
it. All right.